Hello, everybody. My name is Bobbie Wiersema, and this is a presentation for West Texas A&M University's Business Communication for Healthcare Managers course, Leadership Symposium Assignment. Today, I am going to go over an article titled Healthcare Professionals' Perceptions of Learning Communication in the Healthcare Workplace, an Australian Interview Study. This article is by Denniston, Malloy, Ting, Lin, and Rees. First, I'm going to go over the article itself, and it discusses the application of classroom versus hands-on communication learning. So they used the interviews of 20 healthcare professionals across a variety of different healthcare jobs and pooled those answers into a comparison of themes that were identified. So they had three main themes: professional discourse, personal identities, and role modeling as being the most effective ways to learn the communication in the job. So with the professional discourse, they described as provider-patient interactions. And so it's the communication needed to, quote, get something done. And they said that this is basically just the direct communication needed of how are things doing, what do you need, and stuff like that. Very little emotion to it. With personal identities, it was more of an effectiveness question of, for example, the providers would find it easier to communicate with parents if they themselves were a parent. And so this helped with personal connections and feeling that personal opinion and personal ties to those patients. The third one, the role modeling, was how they learn by observing others. And they said that both observing senior positions and their direct peers. So both those that had more experience and those that were at the same level that they was effective in helping them learn how to what to do and what not to do with the communication. So next, a little critique of the article. So some of the credits for it were that they used a variety of clinical positions. So they didn't have just one specific job. Also, they used very open-ended questions. They said that the average interview was almost an hour long. So they had all kinds of abilities for the providers to put in their own opinions and their own experiences. And it wasn't just direct yes or no questions. A few criticisms were that most answers involved only the direct practitioner-patient interaction. There was very few professional peer-to-peer answers. Additionally, there was mostly female practitioners, so they didn't get a lot of the input of maybe how the different genders as providers communicate differently. Also, they in their interview, they didn't have any questions about formal communications training. So it was all about on-the-job training and how they learned with that. So they could have included a few more questions to see like how the difference in those that have had formal training versus those that just learned on the job work. So finally, there's a few discussion questions. I had, what do you think is the best way to get hands-on communication practice while remaining effective in that learning process? And then as a patient, do you find that more experienced practitioners are more effective communicators, and why or why not? Throughout that. So in conclusion, they said that what is seen as effective in training when learning, even with a little bit of hands-on learning, is not always as effective in practice. So getting that hands-on direct learning, communicating directly with patients is the best way for healthcare professionals to get that experience and become more effective in their learning process.